Hello, and welcome to the Food Security for Equitable Futures expert interview video series. In this series, we will interview experts in food security and nutrition, as well as in research methods, to gain a non-technical understanding of this really pressing social problem and how it can be addressed. I'm Jasmine Fledderjohann. I'm a senior lecturer at Lancaster University in the UK, and I'm also the principal investigator for the Food Security for Equitable Futures project. And today it's my pleasure to be here with a leading expert in food security and nutrition. So to begin, could I please just ask you to introduce yourself to the audience, particularly your name, your current institution, and your areas of expertise?
Hello everyone is listening to this channel. My name is Phong and I'm working at Nguyen Tri Phuong Hospital in Ho Chi Minh City. I work in Nutrition and Dietics Department. My major is clinical nutrition and I just have graduated from my postgraduate program this year. My main major is about clinical nutrition, but so food security not is my strong point. But I'm really interested in this subject. So I think in the future I will have more work to done in this field. I hope my experience in working can provide something, some more information about Ho Chi Minh City situation to you.
Fantastic, thank you.
Yeah.
Yeah, I'm really looking forward to chatting a little bit more about your experience, working in a hospital and working particularly on nutrition within a hospital setting today. And then, I'd like to finish up today talking a little bit more about your plans for future research. But to begin, I'd like to just ask if you could tell us a little bit more about your expertise in nutrition, and particularly, do you have any specific countries or regions of focus?
I just have a minor experience in working. I'm just worked for 7 years, so only in Ho Chi Minh City. I didn't have any chance to work in any foreign country or region, just in my hospital. I think I'm living in the most developed city in the country, and my hospital is located on quite a central downtown in the city, but I still recognize many patients, especially the elder one, suffered from hungry, and when I asked them and their family about their daily diet, some people suffer from the lack of accessibility to food, especially after COVID-19 pandemic. So I think that the real picture here is not quite clear, but this phenomenon is absolutely is happening even among people living in the very big city. Yes, the younger one is rarely have a problem with the normal eating pattern. Only when they get sick, they don't want to eat and they got malnutrition. But the other one is the one other kind of problem when they have when they live normally at home, they still have some suffering from lack of nutrition, not because they are poor or they are live very far from the city or live not near from the market, but they just cannot have enough food like their siblings work all day, so they cannot cook, they cannot provide food themselves for a long time, and the result is they have lost their weight a lot, and when they have any just some acute condition, they go to the hospital with a very severe malnutrition.
It's really helpful to have a little bit more about your expertise. So thank you for filling us in a little bit more about, who you're working with and where your expertise within nutrition lies. What do you think the biggest food insecurity challenge in Vietnam is going to be in the future? Sort of thinking both about short-term challenges and then also maybe a little bit further in the future as well.
I think in this time the most most severe and problem is the COVID-19 pandemic. The last year, the pandemic struck only on the southern part of the country, especially in my city. But now it spread to all other region, especially the north. One thing that even though we have many time to prepare, but when the pandemic strike, I think everyone is very confused at the beginning. So, but our country is one of the biggest country that produce food for the world. So I think that we do not lack of the food, but the price for transportation and the food cost has risen a lot.
And you're seeing that particularly in your city?
Yeah. Not only in my city, but I can feel it. Despite I still have the job and my family is not so poor, I still can feel the food price has risen a lot after the COVID-19 pandemic.
Is that something that you've seen, like in the hospital as well? Is that something that patients are talking
yes.
about? Is it something you've seen there?
They not. We didn't do the survey, but I think in the medical staff, between the medical staff, they are worried about their income. Somewhat they will have to work very hard, and I think that it impact a lot. We can extrapolation it to our patient. I think my patient is suffer bigger.
So in the short term, COVID-19 really is having a big impact that you're seeing in the hospital, and you're seeing in your own life as well, and in your city. What about longer term challenges in food insecurity in Vietnam?
I think the long time problem will happen if we don't prepare for this now, because if the government still think Vietnam is very safe from food insecurity, our people may suffer it. When there are so many things happen, it is too late to do anything, because we still have the feeling that we are the biggest and second biggest country that sell rice to the world, but it costs money. So if we cannot go to work, we lose our job. So how can we have money to buy food when the economy has is in a difficult time? I think money to buy food will be cut off.
Okay.
Especially when everything cost has rise. You go to the hospital and we still didn't have the free hospital food service for every patient. Patient need to take care of themselves about what they eat. So it may have a bigger impact in the future. Yeah, especially they need to pay a price, a fee for testing for COVID-19.
Patients in the hospital.
Yes, patients in the hospital, they need to pay for the COVID-19 test, and in the future will be the COVID-19 medical cost. At the first time, government will pay it, but we have too many. Maybe the government need to cut back the cost for it. They cannot pay forever. Yeah, so they must go to hospital and use their saving to spend for the treatment cost. So maybe the budget for food will be cut.
So sort of competing costs for medicine and for food and for the different rising costs across different aspects of life is going to be a problem in this area in the future.
Yes, I think so.
So thinking a little bit more about food insecurity within Vietnam, why do you think it's an important topic?
Not much information about food security on the upper level. They just care much about the availability, the producing of food. We can be sure that it's enough, but the accessibility and the utilization and stability is not a big interest. That even in the U.S. we see that there are a number of, if I remember correctly, is 10% of the people suffer from food insecurity. So how can developing country like Vietnam can be free from that? So we need to now we don't care, so we don't have information, but this is the right time to put more in concern to the way that people can access the food.
Yeah, so there seems to be in what you're saying a bit of a contradiction almost, I suppose. There's a lot of emphasis on food production and rice production, but actually a lot of people aren't able to access that food, and that's being overlooked.
I read a newspaper about this subject, and the leader of I can't remember exactly, but a leader in the agriculture had an answer to the press that we need to utilize this the pandemic to export food to the country in the region. Yeah, that means we have many food. So they will have they can export the excess to help other country. So I think this is not we don't lack of food in short. Yeah. So but it still costs money. So if someone is live in poverty, they cannot access that. Yeah.
Just because there's food available doesn't mean people can access it. As
Yes.
you say, cost is one of the big barriers there, and it's really interesting to hear you talk about that in the context of Vietnam and the discussion around food exports and availability of food.
Yeah. You get my idea.
What can we do about that then? Do you think there's something that can be done to reduce food insecurity in Vietnam?
Okay, in my point of view, this is a very wide area. It's related to agriculture, logistics, commerce. I'm working in a medical system and treat people with malnutrition, but I think medicine can replace food. A doctor only meet patient when they have illness, but when they are at home and hungry, we can't do much thing. I think it is part of our responsibility to talk about this. Maybe if we cannot provide food for all of the hungry people, we will still have to take care of the hungry and sick people. Is a we must have our priority. We must help them. In my hospital, we have a small fund to help poor patient to have free food, but it's still limited sources. We don't. It's not a very big fund, and only a selected patient can reach that. Sometimes they don't want to get free food because some reason like they think it is a charity. It's not a very an easy problem for them. They rather being hungry than eating from welfare food. If we provide free food for all patients, like I think in your country, the government have the free food for patients. Yeah. But in my country, it's still not established yet.
Yeah. Okay. Yeah, I think you're right. The National Health Service would, if you were in the hospital, would provide food in the UK. But also studies from schools, for example, and school meal programs show that it's really important to provide meals universally, right? Provide it for all children, because if it's just children who are in financial need, as soon as they take that food, their peers know that they are in financial need, and there's stigma with that. It sounds like it's maybe very similar in the hospital where you're working.
It is from a group of doctor. They call that the play on the wall. The play on the wall is a copy from the idea the free cup on the wall. When you go to a coffee shop and you buy you go alone, but you buy two cup of coffee, one for you and one you will stick the sticker on the wall, and when when poor people come to the coffee shop, they just get the sticker and get a cup of coffee, so that when you will have other people can have free coffee, and this is the free meal, they call it, and they have a number of free voucher for poor patient to can they can change voucher to change for a free meal. They don't have to pay any money. We have just about 500 a month, or 500 free meal a month. Yes, because it's right now is quite fast. some specific patient cannot eat normal food, and they need to get nutrition from other way, like tube feeding or intravenous. At this time, we don't have the fund. The government don't have the support for poor people. They have a fund for the medicine, but not the food. I don't know why. I don't know why. It the fund have a rule that it must be paid on medicine. We still don't have it on food, so it's
I'm curious about your perspective, because your expertise is in nutrition. I think when we think about a hospital and we think about treating illness, we might think immediately of medicine and the importance of medicine. But what's maybe less obvious to some people is that nutrition is important as well. So I wonder if you could just talk a little bit about that, about the importance of nutrition in your work and in the hospital setting.
yes, it's very important. But the problem is that we don't have the income, the funding for the poor people. I can guide my patient how to eat and how much to eat is good for health. But if they don't have money, that kind of patient is toughest. I don't know. Sometimes I don't know what to do. Yeah, because we don't have fun and they don't have money, so they will suffer from malnutrition.
Paul Farmer, the quite famous medical doctor and anthropologist who passed away quite recently, talked about, as a medical doctor, that sometimes it's very difficult, exactly this is, as you're saying, that you give people advice and you prescribe a course of treatment, but if they don't have the resources, they can't necessarily follow that advice without having, these things cost money, good nutrition costs money, and it's very hard if people don't have the resources for it.
Between medicine and food, I think the budgets will come for the medicine, and they will even the family will cut off their budgets for food.
From your experience as a frontline healthcare provider, right? You've been before COVID, but also during COVID, you've been working on the front lines. You've been seeing people's experiences of malnutrition in the hospital. What would it be helpful to have more research evidence on?
First, I think we need to know the prevalence of this phenomenon. We don't have, if we don't have data, especially the prevalence, we cannot know the magnitude of the problem. We will think it's a very rare cases, very rare. So it's not on the system. We won't change the system. We just take care of that case. That are the our poverty is a very big problem in society. So big doctor cannot do much. If we think that the patient cannot have any help from society. So I think research has to be done to find the prevalence of food insecurity in hospital or more in the community. We still don't have much information about food insecurity in community. So this is the first thing to do.
Okay. And that seems to relate back to your point earlier that there's maybe a perception that it's less of a problem than it is because there's food availability.
Yes.
That's interesting.
One very interesting is that in the COVID-19 lockdown time last year, we all suffer from food insecurity for a short time, for about 1 month, because even you have money, you don't have the access to food, especially healthy food, because they close the market, and they close restaurant, close food store, so you cannot buy food. If you live alone or cannot cook, this is a real problem. You need to eat from canned food. You don't have vegetable to buy because the big market. In Vietnam, we have a very big market. From the big market, they will distribute food to smaller market and supermarket. But the supermarket is closed, and we cannot have enough food to provide a healthy meal on that time. Especially vegetable and fresh food, very rare. It's very scarce, and the cost is rise. It was rising a lot, and many people cannot go to work. The factory closed, or some people were working in some major that cannot allow to open in the COVID pandemic, like the hotel, the travel agency, teacher. Many teacher in private school has quit their job because they cannot teach it offline, only online, and when they cannot teach, they don't have the income, and the private school cannot supply their worker, so they need to quit their job, and that the income is zero, and the food cost was rise, and they cannot go out to buy food. That time, people need to cut back their meal. I also suffer from this. I only eat twice a day because I can't find any food at that time. Even I can go out because I worked in a hospital. I can go out. And I have food from the charity meal from outside. At that time, many people cooked for hospital, because we have to work very hard that time. I think everyone has suffered from food insecurity at that time.
Yeah, so you've got, I mean, you've talked about a really complex set of problems that were happening at the same time: distribution problems, rising food prices, unemployment. Do you think, I mean, you said that people really experienced food insecurity in a widespread way. Do you think people are more aware now? Do you think it's raised awareness?
I think they has something in their mind that lack of food is not an easy problem to solve. There are many people has provide charity meal to the patient, but it is quite just as a group of people gather together and cooked. It's not on a very large scale, so maybe the most the most needed people cannot have that cannot reach to that meal. They cannot access that meal easily, even that is free, because they don't know they don't know the information, because they just a small group, and yes.
So there's a disconnect between who's making the meals and who needs the meals, and it's hard to
they know where to provide it, like a hospital or some cancer hospital. They have a very high prevalence of poor people, but if they want, they cannot know a person is living in a very I would say very deep and hard to find house, and they will suffer it alone.
You mentioned before how people were reluctant to take free meals. They didn't want to feel like they were taking charity in the hospital. Do you think that that still applied to meals during COVID, or do you think because everyone was sort of experiencing food insecurity, maybe there was less stigma with taking the meals?
Yes, at that time, I think it's we are all equal. But it's very different from a short time and a long time lack of food. So if they need to have long-term help, even provide them free food and a job or a house, you need to provide them almost everything they need. Because food is something that can be cut off easier than the bill or medicine, house price, how rent. Yes, it is. You must pay though first, and the food maybe last.
Yeah, it's a place where you could make cuts if you have to, but you can't pay your landlord less, right?
Yeah.
A lot of the things that you've talked about today are big structural problems, right? Poverty, food prices, housing prices. How do you think social policy can address food insecurity? How do we get big solutions to these big problems through social policy?
The journalists should write more about this. In this society, what people is looking for every day is from Facebook or TikTok. So they don't care much about what's happening in society. I think the journalists should write more about this, and maybe the people in the agriculture department should work with the people in the medicine to make a bigger change, not only in producing food, but also for supplying and distribution food. Yes, we cannot think that we are very like a big country in agriculture, and no one will suffer from food insecurity. If we already have a job, a phone, may sometime we think we have the money to eat, to buy food, so we don't think someone cannot have food, still living in this time, but it's still happening. especially after COVID-19.
Yeah. Yeah, and I guess another question that I have, we've talked a little bit about people's awareness being raised now with COVID-19, and more people understand and have experienced food insecurity. So I suppose I wonder, is there anything that you think just members of the public can do? Anyone who's watching this video who just thinks this is a problem that I want to get involved in, is there anything they can do to help address food insecurity?
I think everyone can give a hand. It's not on the only government responsibility. In our society, that we have a tradition to help poor people very much. When they publish that is on the media, social media. If someone is poor and old and sick, is published on the Facebook. After 1 or 2 days, they will receive a very big amount of money. I think we can do it that way. Just you don't need to always write about your richness or how successful are you. Maybe we will need to write more about the hungry, the lack of food, so that young people will have time to think about, at least they don't waste food. And if we have I think that maybe someone from a developed country might teach us how to provide food to those vulnerable people. I think we will very willing to help, but now we don't have much way to do it. We don't need how to do it. So we just do it in a very small scale. And it's not effective and efficient.
So I guess I'm curious, you said everyday people can sort of get involved and can use things like social media, and we need more awareness. But also I think, some of your responses have sort of implied that there's also a role for government. So I guess I'm thinking, is there a way, do you think there's a good way that government and non-government agencies or government and everyday people can work together to solve food insecurity?
Yeah, but we need proof to we need a solid proof to show them. I think the government needs to have data to plan for their solution. But now we don't have. So the first step is we gain data. That is not very familiar in Vietnam, that we have the data to do something. We just do it automatically. So if we don't think it's a problem, we don't have a solution, we don't have a plan, etc. So at first we must point this problem out, and that is my maybe my future plans to help in this area. After I have data in area, I can encourage more people in this nutrition major can do the same research as me, and maybe I would try to teach it for my student Teaching and research is two of my strong points. So I think that it's just everything I can do.
Yeah, so your future plans will
Yeah.
involve sort of getting the data, filling that gap, but then also
Yes.
passing that knowledge along and
Yes,
building on that as well.
yes, that I think that is all I can do and what I can do good. But the other thing is beyond my knowledge, and it's not practical for me to do like community service better than this. Yeah, this is not really my job.
Well, you yourself can't do everything, but I think there's an awful lot of power in as you say, uncovering the data, but then also passing on your knowledge and building a community of people who know about this and are trying to solve the problem. So, yeah. Well, those are all the questions I have for you. I just want to thank you. This was wonderful to have a chat with you. It's a difficult subject. It's a quite serious subject, but it's wonderful to hear your perspective. And I want to say thank you so much for your time and for sharing your expertise. Obviously, I look forward to following your future work. But for now, I'll just say thank you and take care.